Good afternoon. My name is Dr. Stephen Thomas. I'm the professor of health policy and management at the University of Maryland in the School of Public Health, and I direct the Maryland Center for Health Equity. And I'm so excited to be here with you this morning, or this afternoon, I should say, because I'm going to interview Judge Alexander Williams, Jr., who's vice chair of the University of Maryland Medical System Board of Directors on Public Health Disparities. Hey, Judge Williams, how you doing this afternoon?
Dr. Thomas, I'm just feeling real good and just a real pleasure to be with you. And I've just admired all of the great work you've done at the School of Public Health over there, and looking forward to this brief conversation on health and wellness.
Well, I wanted to tell you that this virtual background behind me of the Barber Shop polls is not just for play. It's a metaphor for the kind of conversation I want us to have today, so that we can make it clear, get it down there where the goats can get it, so our brothers and sisters can understand the challenges we face and how you, in the leadership role that you play, are ensuring that we keep our communities healthy. So I'm wondering, what it's like when you have the title of vice chair of the University of Maryland Medical System Board of Directors on Public Health Disparities. Help the brothers and sisters in the barbershop understand. Is that just a title, or does it have some power? How are you going to use that title, Judge Williams?
Yeah, it's a little more than a title. I took for granted just having good health, walking around until the governor put me on that UMS board, University of Maryland Medical System board, and I really focused my attention on health and wellness. It's a powerful board that controls some 16 affiliate hospitals across the state. And it has 4,000 physicians, and it's a budget of $4.4 billion, which is a lot of money. And being the vice chair, of course, enables me to look at the policy issues, ask the tough questions, advocate on behalf of the underserved and disadvantaged communities. And that's what I've done. I also, because of that position, I was also named chair of one of the affiliates, chair of the board, and that's the University of Maryland system in Prince George's County, the capital region. Yes, capital health region.
Well, I'm in Prince George's County right now, so I'm going to come back to Prince George's County in particular with some questions, but I'm going to have you stay right there at the UMS level, that big organization, as you mentioned, $1 billion budget. And then the pandemic hits. These health disparities existed before the pandemic. Pandemic hit, we started calling those things the underlying conditions. You remember the cancer, the diabetes, the obesity? But the pandemic exposed a lot of things, Judge. It's like a stress test on our systems. What can you share with us about the challenges that you observed once the pandemic hit and that big system had to go into action to address health disparities and health equity?
Yes, great question, Dr. Thomas. Again, things are rolling along wonderfully. I was enjoying the every 2 week reports by the staff, but then pandemic hit, and boy, did it hit our people, people of color, in a mighty way. And that's because of the underlying health problems that we have that you mentioned, again, obesity and cancer, diabetes, hypertension, and all of the strokes and so forth. So it hit our people in a mighty way. And if you look at the number of persons dying and getting COVID and being hospitalized, there was a disproportionate number of African Americans and brown people who were hit with this thing more so than the others. So I had to start paying a lot of attention to the numbers, the dashboards, to see who was being admitted, how the patients were being treated, and looking at the staff, whether it was adequate ventilators and protection for workers and so forth. So my mind focused on all of that, and I began to ask the tough questions and pay attention to the dashboards that were being given to us on a weekly basis.
Well, Judge, in those numbers, over 900,000 dead across the country. And as you have mentioned, a disproportionate number of them are Black and brown. And I'm thinking about all of the grief, all the loss, all the inability to even to when your loved one did pass away, we didn't even have the funerals in a normal way because of the pandemic. And so I'm wondering, in addition to the physical disparities, the diabetes, the cancer, the obesity, the physical health disparities that we talk about, when you think about all that we have lost, the isolation, all those things, they also impact our mental health. We don't always include that when we think about the different organ systems. Can you say something about how the pandemic raised awareness about the mental health issue and how has the system adjusted to address it?
Yeah, for so long we've ignored that. And this is, Dr. Thomas, as you know, a very, very stressful world with a lot of issues out here. And in addition to all the problems that Black Americans in particular have with not enough insurance, no access to doctors, no access to health, and so forth, in addition to that, emotionally, we were kind of caught up in the numbers, the sudden loss of loved ones. And as you said, the churches closed the doors. They couldn't have funerals there, and was just so much involved. And mentally, our people were at a loss. And not only were the adults, but children, young people also have mental issues because they're trying to learn virtually now. They get bullied on social media. They can't see their friends anymore that they normally have had in school. All of this leads to mental challenges that not only our people and adults have, but young people have from that standpoint. And of course, we can talk later about the mental issues that the incarcerated and people in jail have. But this mental thing is a challenge, is something that we have to be more mindful on, and we've got to address it. But anyway, that's my thoughts on that.
Well, it's an area that's also somewhat stigmatizing in our Black and brown communities when you talk about mental health. And if the pandemic has taught us anything, is the need to address those fears and concerns and take them seriously and not shame people, not blame people. And so maybe we need to think about the language we use. Maybe emotional wellness is more inviting, for our people. But I can tell you right now, Judge, in the barbershop, I just start talking about stress and I get all the way into those mental health issues without stigmatizing folks. That's another way we can reframe the issue. So when you
Yeah,
think about, yeah,
yeah,
go ahead.
and in addition to that, we just shouldn't feel embarrassed that we've got to reach out and get support for some of the mental challenges and stress challenges that we're having because of this tough life right now. People can't feed their families anymore, and they don't have decent jobs. And unlike a number of other communities that can work virtually, many of our people can't do that, and they can't socially distance and do the other kinds of things that we've been asked to do as part of the remedy for this thing. So it's just a lot of stress out here mentally and overwhelming families and groups.
And you talk about language, Judge, when you talk about the essential workers, that still had to go out in the middle of the pandemic, you think about it as a blizzard. There's a tornado out there, but the essential workers have to go out. And you think of those medical staff and others. But you know what, Judge? Throughout this entire pandemic, my trash has been picked up every day. If it wasn't a holiday. So who could have imagined that the sanitation team, the garbage man, was an essential worker? Who could have imagined that those low wage workers in nursing homes were essential workers? They didn't feel that way until we labeled them that. And many of them feel that they've been put in danger's way because of the things you've just mentioned. They couldn't take off. They didn't have an ability to stay home and work on Zoom and make sure your trash was picked up.
Yeah, and in addition to that, Dr. Thomas, is so many of them sometimes often in a home. How can you socially distance when you
That's
have that
right.
situation? And then so many don't have computers. They don't have access to the internet. It's just so many issues that people of color have in this entire area of the pandemic. And we're struggling. We're definitely struggling.
So the pandemic can have a silver lining. I'm always looking for the silver lining, Judge. So when you think about this, and you see everybody trying to throw off all the mitigation, throw off the mask, I'm just hoping we're not spiking the ball on the 30-yard line and calling it a touchdown, because that would be a fumble. So there's still danger out there, but there are some silver linings. And I'm wondering, from your vantage point, when you think about how the system responded in the pandemic, can you give me one or two things that you really like about what you've observed?
Well, one of the things that I certainly have appreciated is that systems like UMS and other systems, Hopkins and other places, they're beginning to reach out right now and identify communities that do not have access to the proper treatment. And what is happening right now is that many citizens are now becoming more alert and informed about health and wellness issues. We're paying attention now to let's not smoke as much. Let's jog and let's walk a little more. Let's look at the food that we're eating and that sort of thing. And so from that standpoint, I think we're more in tune with those kind of things. And then, of course, the other thing is that so many of us didn't have family physicians and primary care physicians, and we're looking for them now. And more and more of them are now surfacing, and we're getting more attention to our health. I'll just say this, Dr. Thomas, my family physician, my primary physician passed about a year and a half ago. And
Mm-hmm.
I was out here searching for a primary care physician. And I'm in Prince George's County also. And I called 3 or 4 physicians. They said, we aren't taking anymore. And I got real concerned. And so I called one of our mutual friends, and he gave me a hookup, and I was able to get one. But let me say this. Now, this is the chair of the Prince George of the UM hospital in Capital Region. I couldn't get a doctor. So what does that mean for somebody who's not in the same position than I am? So I think we're getting more and more focused on our health needs and some of the challenges that we have. We got to pay attention because our people are leaving here far too quickly than we ought to, and we've got to start focusing on health and wellness.
Absolutely. You know what they say: when America gets a cold, black folk get the flu. And then
Or
America,
pneumonia.
yeah, there you go, pneumonia. So, so we're really hurting out here, and the problems are easy to identify. They've been exposed in big ways because of the pandemic, and some of the things you've just described that you like are excellent. When these systems are bringing their mobile units out to the churches, they're bringing their pop-up clinics out to the barbershops and beauty salons. I really want to salute the hospital systems in your network that have been willing to pivot and come up with pop-up clinics and really be flexible on the ground. So, given that, Judge, what do you wish for? What do you wish for?
Well, I'm hoping that more and more communities of color can understand the importance of health and wellness. You can't take these things for granted anymore. You've got to be on the alert. You got to pay attention to warning signs that's coming up. Our Black women need to make sure they get maternity counseling and treatment before they have these children, because again, as you know, the maternity and the deaths of morbidity for children and mothers are far greater than in other communities. So I'm hoping out of this thing that more emphasis will be put on focusing on our health needs individually and for families and so forth. And then the other thing is that we all need to advocate and tell our policymakers that you've got to give more resources to certain communities. You've got to provide greater insurance. You've got to make sure that there's access to health to more people from that standpoint. So I like the idea that our antennas are up right now. We're excited. We're asking questions. I'm certainly asking questions on the board because, as I said, health didn't mean much to me before I got on that board. I took for granted that I could walk around a little bit and could jog a little bit, but when I see this $4 billion operation out here controlling 16 hospitals and serving millions of Marylanders, then it became clear to me that I need to pay careful attention to this. And I need to share this information with other communities. And I try to do this by partnershiping with you and other groups and other colleges and institutions so that people will understand what this thing is all about.
Well, Judge, I consider what we're doing right now part of that silver lining. Look at us in a Zoom platform that's going to be streamed across the country. Zoom existed before the pandemic, but we're using it now smarter. Now, you mentioned what's happening with our Black mothers and daughters and maternal mortality. And, the New York Times came out with an article in February. It was actually February 24th, finding that maternal deaths in the United States climbed in 2020. And a third of those who died were Black women, Judge. What's your reaction to a headline like that, especially when you're sitting in the boardroom?
Well, it's just shocking, and it's real sad that this COVID just has had a unique impact on Black women in particular. And Black women are stressed out, they're burdened. And I think that they worry more about jobs and feeding their family. And the policy makers have to understand that Black women have a unique role. Not only are they assuming the role as the breadwinner, but they also have to raise these children often by themselves, and they have extra stress that others don't have. So you can understand why a lot of them need counseling. They have mental challenges. They also have chronic conditions like anemia, cardiovascular disease, obesity. And I was just reading yesterday in the Washington Post about a woman who has this postpartum situation. It was in the Washington Post. I think it was the style section, and she's concerned about threats of police brutality and excessive force on her children, her sons, and all of these things come to bear, and they weigh down, they burden Black women. And so I would like to see more sensitivity by policymakers that Black women have a unique role, a unique burden, and we need to make sure they have sufficient resources, that they can get a good job, that they can get, again, insurance. And because let's face facts, and I'm going to say it clearly, Black women have been at the low end of the totem pole in terms of economic success and so forth. They've had the lowest paying jobs. They've never had an opportunity to do things. And this recent nomination of Ketanji Brown Jackson to the Supreme Court, this was so necessary. And I was so excited because this is the first time a Black woman has been nominated to a key job in our country. And Black women, it's time for you to step up and recognize the role that you serve for your people.
And I think it's very important for them to hear a robust endorsement, robust advocacy from you, Judge, from me, and all the other men out there who need to lift up our women and children, and be mindful that this pandemic has had a devastating impact on the family. Of the 900,000 plus people dead, Judge, we've already talked about the fact that a disproportionate number of them are Black and brown, and many of them are caregivers of children. We got the grandmothers who would be the primary caregivers. When they die from COVID, who's taken that job over? So the orphans, Judge, we got orphans, COVID orphans out there, and a disproportionate number of those COVID orphans are Black and brown children. When you become an orphan, Judge, and end up in the system, foster care system, no matter how good it is not as good as a stable home. How likely is somebody then to end up in prison or to be touched in a negative way by the criminal justice system when you become an orphan, when you become a ward of the state?
Yeah, when Dr. Thomas, you said it better than I, when you don't have a strong family environment, you have housing challenges, You have educational challenges in the sense that so many of our children are not learning right now well on a virtual standpoint. And there's just so many issues out there that's affecting the wellness and health of our people. Of course, there's also what they call structural determinants that also bear upon health. And I'm talking about lack of transportation. I'm talking about language deficiency. I'm talking about lack of education. I'm talking about lack of nourishing food. I'm talking about poverty. I'm talking about not being able to get around, not having access to the internet, and all of those economic instability matters. All of those things tribute and they drive bad health and lead to the challenges that have to be corrected. So this business of social determinants is a key issue, and we just can't look at this thing and just reach some conclusion that, oh, black people have internal health issues and that's all to it. No, there's social justice issues that come into play, and they also drive health problems.
I'm so glad to hear you talk this way, Judge, because so many of those diseases of lifestyle, the diabetes, the heart disease, the obesity is many times blamed on the individual. You don't have discipline. And so what you're describing in these structural determinants of health, if you don't live in a safe neighborhood, you're not going to be out jogging. If you can't take off from, if you have a job, Judge, that just grinds you all day long, you think you're going to come home after work, house full of kids to feed, and then start your exercise program? We've got to understand the structural dynamics and not just blame people for the circumstances in which they find themselves. And I'm wondering if the pandemic will help us do that in a better way, because those systems did pivot. They were out there providing information not just about COVID, but about those underlying conditions. I just don't want them to go away when the surge is over, Judge.
Oh,
I
yeah,
want to keep
absolutely.
them out there engaging the community in a new, more trustworthy way.
Information is the key. And we've got to put on more webinars and more seminars. And as I said, you and I, Dr. Thomas, we need to partner more so that we can reach out to the community and let them know what's going on in the area of health and safety and wellness and that sort of thing. So I'm all for it. You're going to hear from me in the months to come, because I'm already in my mind planning something that we can have a nice partnership on some campus and invite people in so they can learn and get education and get informed about what's going on and what the challenges are for all of us.
Well, I really like that. And I think from the position you're sitting at you can bring not only our universities together, but also our HBCU brothers and sisters. That would be a wonderful thing for the health system to be the convener of our academic institutions around these topics, because we're not just talking about the narrow silos of different organ systems, especially when we get into the social determinants of health, and recognizing that those social determinants are part of health. But no physician can write a prescription to end poverty, Judge. And
That's
so
right. That's
that's
right.
why I want to ask you about what we observed during the pandemic with people who couldn't social distance, with people who were in congregate living circumstances. And I'm really interested in the role that you played as chair of the Prince George's County Reentry Advisory Board. How did your involvement in the medical system influence the recommendations on improving health access for what's called returning citizens? And for those out there in cyberspace, YouTube listening to us, we're talking about, well, I'm going to let you explain it, Judge. What is a returning citizen and what was the Reentry Advisory Board?
Yes, yes. So thank you for asking that very important question. As you know, Dr. Thomas, two reasons helped me with this board, the Reentry Advisory Board. One is just the policy center that I founded, the Judge Alexander Williams Jr. Center for Education, Justice, and Ethics. And part of our focus would be on reentry and criminal justice reform. So that's one thing that drove me to agree to chair this board. The other is just what I have seen in my role with the University of Maryland medical system and the things that I've learned and the passion that I have. And it drove me to think about the plight of those who are incarcerated. And for those listening, the reentry would be those who have finished their sentence or they're being released and they're being returned back to their community to re-engage into the community if as best they can. Some of them have been locked away so long they don't even know anything about the internet. They've got to be learning how to use a computer in that standpoint. But more critically, for those who are re-entering society and trying to again readjust, many of them have mental challenges. Some of them should not have even been locked up because again, why lock people up whose behavior is more a result of mental challenges more so than a criminal behavior activity? So that's part of the problem. And that's the interest that I had. Let's get people out of incarceration who need to be treated. And what's happening with these correctional institutes like the Prince George's County Corrections Board is that they fail to really identify and to screen and to analyze the illnesses and challenges that many of the inmates have. They don't have adequate staff. They don't have screening that's appropriate. And these people are allowed just to languish there. And then when they get out, they still have mental challenges that need to be addressed. They don't have any insurance. They don't know how to look at Medicaid. They don't know where to go to get help. And many of them are afraid of going to a doctor. So these things interest me. And it's one of the reasons why I have focused my policy center on the plight of the reentry. And I'm here to tell you, we need to remove all these barriers that have been imposed on people coming back into the community. You don't want them to vote. You discriminate them from jobs. You don't want to give them Pell Grants so they can get education. And you don't want to give them any insurance or Medicaid so that they can get treatment when it's necessary. So a part of my passion, again, is for the reentry and to help them reunite, reintegrate back into society in a positive, successful way. And I'm glad you mentioned the historically Black colleges as places where we can go, because Dr. Bro of Bowie State University is on the board with me, on the University of Maryland Capital Region board. She brings so much to that board, and she has already agreed to partner with you and your organization, my organization, maybe compensate to try to talk to and recruit nurses. There's a great shortage of nurses out here right now. And just inform the public of this whole business of health and wellness. And we've got to open the door and bring them in and let people know what's going on in this area. It's so important. And so Dr. Bro I'm just so happy with her, crazy about her. So well, thanks for mentioning that.
She is a very impressive president. And Judge, I'm just so encouraged listening to you. I did not imagine when I was coming through my training that a judge would be an advocate for public health, or that by this stage in my career, the realization that the very things you deal with as a judge are public health issues. Amazing. Yeah. And so I'm wondering about the fact that, yes, those returning citizens have many, many challenges, Judge. But you know what? One of the first stops is going to be to the barbershop so they can look good, right? And in a traditional Black barbershop, I want the audience, YouTube audience out there to know that you might have that returning citizen with all the challenges you just described, waiting for his chance to get in that barber chair, but he's sitting right next to the judge without the tie, because you're getting your hair cut at the same place. So if we could make our barbershops and beauty salons, they're already trusted places, and bring these services right into them, wouldn't that be a game changer, Judge? Can we think outside the box and bring these services right to the places where people already have trust?
I'm so glad you mentioned, the barber shop. Again, uh, that's a place where we have conversation, you meet people, you have casual talks, and that's a great opportunity for people like myself, you, and others who are in this field to stretch out and talk to people about health and wellness. Black people, one of the challenges that we have to narrow this gap is that Black people don't trust scientists and physicians and so forth. They remember that whole thing with the syllabus, syllabus, what is it, Tuskegee?
Yeah,
Yeah,
the
yeah,
official name is the U.S. Public Health
that's right.
Service
Yes,
syphilis study done at Tuskegee. You're
yeah,
right.
yeah. They remember that Black people have always been used as guinea pigs. I'm going
Yes,
to say it. And they don't trust it. So barbershop is some place that they can go and get the real deal from people like you and I that's there and feel for them. They stole the organs from the lady at the Hopkins. You certainly remember that. There's been Black women from slavery were
yes,
had procedures and were not even given any anesthesia because
that's
they
right.
felt that Black women could stomach pain. They could
Yes,
feel nothing, and all
yes.
these kinds of algorithms. Is that what they call it?
There
All
you
these.
go.
Is that what it is?
Algorithms in the
Yeah,
computer.
yeah, that's right. All these are myths, things about Black people and their health and why they don't reach out more. And so all this nonsense has got to be stopped and it's got to be addressed.
Well, Judge, this is why I'm so glad that we live in the great state of Maryland, because the legislators in Maryland had the foresight to realize that all the issues that you and I are talking about here today, and they passed legislation. And here's what's interesting: this piece of law passed the first time. You know how sometimes a bill has to go 3, 4 years before it gets passed. The legislation on implicit bias training for health professionals passed the first time around. So
Wow.
in the state of Maryland, to get your license renewed, you must complete implicit bias training. Hey, Judge, I can't believe how the time has flown.
Yes,
We need to
yes.
do this again. And before we close out, I'm going to ask you this question. I want you to think about a word that best characterizes how you're feeling right now at this moment in the pandemic. And just share that word with the audience and then give us your closing comments.
Yeah, I would just say I'm both concerned, but at the same time, I'm excited about the future and what happen as we begin to share this information and do more research and put more resources into this area of disparities and so forth. I want to thank you, Dr. Thomas. You are the expert. I should be interviewing you, but I want to thank you for this conversation that we are having because, again, health and wellness has become so big in my life right now. And even though I'm known as a senior citizen right now, I still am concerned about walking and jogging and getting my tests and getting screened for prostate and all those kind of things. And I'm just hoping that more people of color and minorities will think the same way to get regular checkups and screening and do what they're supposed to do it so they can live as long as God would have them to do it.
Well, I'm going to tell you, you would be so pleased with what's happening in the barbershops because that conversation is happening in the barbershops and salons. And right here in Prince George's County, as the case rates came down, we now have the lowest spread in the state, Judge. And it's because of the out of the box innovative strategies that we put in place here in Prince George's County. Judge, everybody knows where UMS is headquartered in the great city of Baltimore, but I want them to know where your center is located. Give them the
Yes.
full name of your center and where you're located.
Yes, thank you so much, Dr. Thomas. I created in 2015 the Judge Alexander Williams Center for Education, Justice, and Ethics. I'm in the college or affiliated with the College of Behavior and Social Sciences, and I'm on the campus at the University of Maryland. And I can proudly to say that so many of our employees are students. I
Yes.
get my strength and my direction and our research from our students. That's a big part of this center.
I've been so impressed with opportunities for our students to work with centers like yours right here in College Park. And I just want to say to you, Judge, thank you so much for your time today. And I hope that this is a beginning and not an end. We can meet again next time out in the barbershop. How about that?
Absolutely. Thank you.
Make it a great day, my friend.
Have a good day. Thank you. All right.
Bye-bye.
Bye-bye.
Allie?
I
I guess we'll close.